If you get food benefits, also called SNAP benefits or food stamps, there have been changes to the work rules that might affect you. If you're between ages 18 and 64, you may need to work, volunteer, or participate in a training program to keep your benefits, even if you didn't before. If the work rules apply to you and you don't meet them, you can only get SNAP food benefits for 3 months in a 3-year period. But don't worry, we're here to help you stay on track and keep your benefits. This video explains who needs to meet the work rules, who's excused, and how to report your hours. Many adults ages 18 to 64 who don't live with a dependent child younger than 14 will need to meet work rules. This includes some people who were previously excused, like those 55 to 64, those with children age 14 to 17, veterans, people experiencing homelessness, and young adults who were in foster care on their 18th birthday. Even though there have been changes, some people are excused from these rules. This is called an exemption. You may be excused if you are younger than 18 or older than 64, live with a dependent child younger than 14, are pregnant, disabled, or unable to work, are in school or a training program at least half-time, are caring for someone who is sick or disabled, are receiving or have applied for unemployment benefits, or meet other special circumstances. Check with a SNAP caseworker. They can help you find out if these rules apply to you and if you need to provide any documentation. If you need to meet work requirements, there are a few ways for you to do that. You need to complete at least 80 hours each month, or about 20 hours a week, doing one or more of the following activities. You can work for pay. This can be a full-time, part-time, or self-employed job. Participate in a job or training program. Ask a caseworker about SNAP employment and training, E&T, or other approved programs. Volunteer. You can volunteer at a nonprofit, charity, or community organization. Workfare. You can participate in workfare programs where you work in exchange for your food benefits. A caseworker can tell you if this is an option for you and how many hours you need to complete, which might be different than 80 hours. A SNAP caseworker can help you meet your 80-hour requirement and can connect you to resources like job or training opportunities that work best for you. It's important for you to keep track of and report your hours so a caseworker can make sure you keep your food benefits. Ask a caseworker for more information on how to do this. Here's how to keep track and report your hours. Step 1. Keep record of your hours each week, regardless of what type of activity you are doing. For instance, if you are working, save your pay stubs, signed timesheets, or a letter from your employer. Step 2. Report your hours. Report your hours when you apply for your SNAP food benefits and when you renew your benefits. You also need to report any time your hours drop below 80 in a month, even if it is not time for you to renew your benefits. Make sure to let a caseworker know again when your hours increase. You can show proof of your hours with pay stubs, a timesheet for work, volunteering, or a training program, or a signed letter. If you can't get a document, a caseworker can help confirm your hours. A caseworker can also show you how to submit your documents, for instance, by uploading them online, emailing them, or bringing them to your local office. Some people need to report other changes to their job, volunteer activity, or training program participation when they happen. For instance, if you change jobs or your pay changes, ask a caseworker if that applies to you. Keeping track of and reporting your hours will help you keep your food benefits. Remember, if you don't meet the 80-hour rule, you can only get food benefits for 3 months in a 3-year period. We are here to support you to keep your SNAP food benefits. Here's how to get help. Call your state's SNAP helpline, visit your state's SNAP website, or talk to a caseworker. They can help you find work, training, or volunteer opportunities that work best for you.
If you've got Medicaid, make sure Medicaid's got you too by keeping your contact information up to date. Every year, Medicaid has to confirm your eligibility. That means we need to be able to reach you with information or questions. You'll get a letter letting you know what we need, or that your coverage has been automatically renewed. If we don't have what we need, we'll contact you to provide any missing information. Reply right away so you can keep your Medicaid coverage. If you're no longer eligible for Medicaid, we'll send you a letter about other health coverage options and financial help that can lower your cost. 4 out of 5 consumers can find coverage for less than $10 a month. And all plans cover things like prescription drugs, doctor visits, hospital stays, mental health services, and more. Don't wait. Whether you still qualify for Medicaid or not, make sure you have a plan to stay covered. Keep your health. Keep your coverage.
Si tiene Medicaid, asegúrese de que Medicaid también tenga su información de contacto actualizada. Cada año, Medicaid tiene que confirmar su elegibilidad. Eso significa que necesitamos poder comunicarnos con usted con información o preguntas. Recibirá una carta informándole lo que necesitamos o que su cobertura se ha renovado automáticamente. Si nos hace falta algo, nos comunicaremos con usted para que nos proporcionen la información necesaria. Responda de inmediato para que pueda mantener su cobertura de Medicaid. Si ya no es elegible para Medicaid, le enviaremos una carta sobre otras opciones de cobertura de salud y ayuda financiera que podría reducir su costo. 4 de cada 5 consumidores encuentran cobertura por menos de $10 al mes. Todos los planes de salud cubren medicamentos recetados, visitas al médico, estadías en el hospital, servicios de salud mental y más. No espere más. Califique o no para Medicaid, asegúrese de tener un plan para mantenerse cubierto. Mantenga su cobertura de salud.